It's fine. You have to get a freaking time.
Okay, guys, this is Pueblo Community College EMT class. We're doing medical assessment practices.
Quite a few years ago. No, you use chalk, but it's that eco chalk. You ever heard of that stuff? Yeah, it's not like super expensive or anything. They like you to.
See the safe, sir.
So, general impression.
As you're looking at them, they're in this, it's supposed to represent as a recliner. They're laying down.
This is a recliner.
Yes, sir.
So it's going to be medical or trauma. I'm not going to consider C-spine at this point.
Okay.
Okay. So, is he awake?
He is. He's looking at you. He wants to sit up, but it's just hard for him.
Okay.
And when he does sit up, he kind of leans all the way forward
All the way.
in
Okay.
a tripod position.
All right. How's his airway?
Airway is open, but you notice a lot of secretions coming out of it.
Okay. So, Luke, can you prepare suction for me?
Yep.
And let's get ALS on the way.
Okay.
I'm going to establish this as a priority patient.
Okay.
Okay. So, how's his breathing?
Breathing is about 38 times a minute. Now
Okay.
remember, this is a 6-year-old.
Yeah.
So, okay, symmetrical rise and fall of the chest.
Okay. How's his lung sounds? I'm going to listen to those primarily.
Lung sounds are clear in all fields.
Clear in all fields. Okay, getting a pulse and feeling skin. What's the skin condition and pulse, please?
Pulse is
That's Christian. You guys seen him before?
128. Skin is pink, hot, and diaphoretic. You start to notice that the child is having audible wheezing now as time's going on.
Okay, so is he able
That's
to
Robbie.
talk?
He tells
Hi,
you
Robbie.
it's hard to swallow.
It's hard to swallow. I'm going to ask the parent if the parent's there.
Yep, mom's standing here.
So, how long ago did this start happening?
He went to bed about 9 o'clock. Just wasn't feeling good. And then about 20 minutes, he started complaining that he was unable to breathe and just couldn't swallow.
Okay. And anything that could have caused this?
He has been feeling sick for the last couple of days.
Okay. So what's the quality of his breathing?
He's your symmetrical rise and fall, nothing obvious that's telling you. Just that audible wheezing.
Just the wheezing?
The wheezing.
Okay. No stridor?
No stridor, yeah.
So on a scale from 0 to 10, 0 being no difficulty at all, 10 being the worst, what would you scale it at?
Moderate. So
Moderate,
maybe
so
about a 5. Yeah.
Okay. Is there any pain associated with it?
Not so much pain, just
difficult.
hard to breathe.
And you said this happened how long ago?
It happened about 20 minutes ago. Was the onset.
Right. So, is he allergic to anything?
Augmentin.
Augmentin?
Yep.
Which is used for what?
It's a penicillin, part of the penicillin family.
Okay. Is he on any medications?
Doctor told me to go ahead and give him some acetaminophen for pain and fever. Due to the fact, like I said, last night, he was just, yesterday he started complaining, he wasn't feeling good, so I went to the doctor and they said give him some acetaminophen.
Okay, Robbie, start him on 4 liters of nasal cannula, get some vitals and temperature, please, and BGL.
Okay. So, your VGL kicks back at 98.
Okay.
Blood pressure, as he's getting it, is 104 over 62.
Okay.
His respiratory rate is 38. His pulse is 128. And he's setting at 92% on room air.
Okay. Any past pertinent medical history?
The only pass is none.
The only pass is none?
Yeah, no medical history.
Okay.
Mom tells you that I did do a thermometer earlier, and he was 101.5.
Okay. Maybe we can yell at the spirit.
And that was probably about 2 hours ago when I checked his 10.
Okay. So, what was his last oral intake?
His last oral intake was dinner last night.
Besides the medication?
And that's the only thing, just that. Medication and dinner.
Okay. And so
Mark,
Yes.
do you care if you're on video?
No.
It's instructor
So,
certain
my
teaching the
secondary-
EMT class.
Okay.
what's his airway like after suction?
That's Mike being the lead.
Airway is still that wheezing, that
Okay.
audible wheezing.
But it's-
still drooling. No matter what you do, he's just drooling and drooling and drooling. And he's still leaning. So he's basically like this, and then he leans all the way forward
On breaths?
on breaths, and then drools, takes a breath, leans back, leans forward, drools, takes a breath. So he's doing a lot of drooling, a lot of leaning forward in a tripod position right there.
Just keep the suction going as we go. So, do my head and toe. So, anything on cranium?
Nothing noted.
How's his eyes?
Intact,
Pupils?
intact, and reactive.
Okay. Ears?
Intact?
Any jugular vein distension?
No.
Okay. Any clavicular?
Nothing noted there.
Okay.
When you go to touch his trachea, he tells you, "Ow, that hurts. Don't touch that."
So he's got soreness in the throat?
Yeah,
Okay.
big time. And when you stick that tube in, he tells you, "Ah, that hurts."
Okay. Perfect. So, how about chest pain?
No chest pain, just
Okay.
shortness of breath.
Okay. And I'm gonna feel abdomen first, just in case.
No pulsating mass noted.
Palpating.
Intact, intact,
Okay.
intact.
Okay.
No grimacing, no reaction.
No nausea, vomiting.
Nothing noted.
Okay. How's his legs? Any edema? Anything noted?
Nothing noted.
Squeeze hand, squeeze fingers.
He squeezes, he leans forward, drools a little bit more.
Okay, my field assessment is epiglottitis.
Okay.
So I'm recommending transport. I'm gonna put him. How's he statting with the?
He's setting at 92.
Okay.
When you put him on the nasal cannula, he went up by 93.
Okay, let's put him on a non-rebreather, guys. Just get his oxygen going good.
That's
Okay.
Luke there getting the oxygen.
15 liters.
Okay. He goes up to 95.
Okay. We'll just keep him there
Okay.
for now. And then I'm obviously gonna establish him as a priority patient,
Okay.
and let's get him ready for transport.
All right. Is there anything else you want to do?
Is there any concerns from the mother besides, when I look down the throat, do I see?
You can't. All you see is redness.
Okay. So,
Bree's taking notes
is
for
there
him.
any swelling?
Yeah.
Okay, cool. So let's get him loaded. I got feet.
So your partner kicks back, lets you know that, hey, I got a temp of 103.4.
Okay. So obvious infections. So possible epiglottitis that's causing an infection. We're gonna transport the
Okay.
emergent. Alright, call in hospital.
Go ahead.
Med 7, St. Thomas More, stable medical, heavy coffee.
Copy loud and clear. Go ahead.
Okay, I have a 6-year-old male, complaining of difficulty breathing.
Okay.
My baseline is BP 104/62, respirators at 38. Lungs are clear. heart rate's 128. Skin's pink hot and diaphoretic. We've got a temp of 101.5. There's wheezing in what part of the airway?
It's in the upper. Yeah.
So wheezing in the upper part of the airway, BGL is 98, O2 92. Placed him on, primarily I placed him on 4 liters nasal cannula and upped him up to 15 liters non-rebreather. Last normal intake was dinner last night. He had acetaminophen for fever that mom gave him last night. He's been drooling in a tripod position, red swollen throat. And he was laying down initially. And this started about 20 minutes ago. Second set of vitals are as follows.
As follows, it's going to be 110 over 66,
10 over 60.
pulse 128, respiratory 38, 95% on 15 liters a minute.
Okay. And what's the secondary temperature?
Secondary was 103. That's the one I was trying to tell you. That 103 over 4.
Alright, so we'll be coming in emergent. And if I could start a line, I'd start them on cool fluids.
Okay.
I'd keep a blanket off of them for now.
What else would you like to do for the airway, just out of curiosity?
I'd keep them upright, but
Okay. Think of more of what oxygen does at that flow, 15 liters a minute. The mucosal area ends up doing what after a while? There's one product you guys can use in your toolbox.
put him on
Humidified oxygen.
Yep.
humidified oxygen.
Put them on humidified because you don't want them to dry out.
And I'd check his capnography.
Yep. So capnography kicks back that it's like foam.
Okay, so his cap, I'd also report that on cap.
Okay.
And then CM5.
Sounds good. Now, curiosity. If you would have known that there was epiglottitis, would you have done any suctioning right away?
No, but I want to keep
So,
some sort of airway patency.
so how would you do it? Just let them sit in that tripod position
And let them drain.
Just let them drain it out.
Okay.
So, and that's all you can do.
Yeah.
And I know this for a fact because this call I actually ran. I had a 4-year-old or a 6-year-old that literally had all the signs and symptoms that you just ran. And that patient, I didn't do nothing except put him on O2, didn't even look at his airway, didn't do nothing. Just threw him on a mask, threw on O2, transported to the hospital and told the doctor my patient's having epiglottitis. He called me a liar, looked at the patient and said, I take that back, you're absolutely right. Because it was at the beginning stages of the epiglottitis, where he kept leaning forward and drooling and leaning back. And then he would lean forward and then he would lean back. And that's when the doctor thought, no, that's not it. Found out he was.
Okay.
But good job, sir.
Just to start airway patency.
Yeah, that's all it is. So, good job.
Sweet.
We're good.
We'll get it next time.
That's Robbie. This is Mike. Say hi, Mike.
Hi.
Brennan, say what's up.
We heard some.
Christian, you guys seen Christian before? This is Trey.
Hey.
Aaron.
What up?
Bree. Luke. What's going on? So that was EMT class. Basic EMT class at Pueblo Community College. Medical assessment practice. So this instructor certain.
How you
How did he
doing?
do? Did he do all right?
Yeah, he did good. He did good. Epiglottitis is one of those hard ones. You just gotta work your way through it. So, you know, and he figured it out real quick. Don't stick nothing in the airway.
He did, was quick on that.
Yeah,
diagnosis,
because he
wasn't he?
realized that sometimes you don't want to do that. So, you know, don't stick things that don't need to be in there. But on that, that's what we got.
Awesome.
And on to the next student.
All right, there you have it, guys. We'll see you later.
Are you ready, sir?
More ready.
All right, you're up next.
Couldn't even
You are
talk or
very
eat by
impressive.
myself.